Fredericks. Just in at 4, the FDA ruling on COVID booster shots, rejecting Pfizer's request for a third shot for those 16 and up. In a 16-2 vote, the FDA panel rejecting the plan to add the third shot. But why?
I have major concerns with regard to the extrapolation of data from much older populations to 16 and 17-year-olds. We have no data on the safety in this population at all that have been presented so far, and that concerns me significantly.
That sentiment echoed by many committee members, several officials saying they need to see more data before recommending it. But here's what the committee did do. They voted yes unanimously to recommend a booster dose for people who are 65 and older and anyone at high risk. This meeting is just the start of the booster shot approval process. And important to note here, the advisor's decision isn't binding. The full agency and the CDC could move in a different direction, although that is uncommon. So let's turn now to our ABC15 Health Insider, Dr. Andrew Carroll, to break this all down for us. Thank you so much for joining us. First of all, we appreciate it. Let me start with this. Dr. Anthony Fauci, the president's chief medical advisor, said just this week he believes a third dose will be needed based on the data that he's seen. So what do you read into the panel's decision today?
So when scientists look at this information, right, and this is 20 scientists, physicians, researchers, epidemiologists, they look at the data that we have out there. And per this data, they feel that a booster is really only appropriate for people 65 and up. And I think that's a really great recommendation. Remember that the first group we immunized was the seniors and those at high risk and healthcare workers. And this recommendation really mirrors that. And they're saying that people who have had those shots 6 months ago should get this booster to improve their ability to fight the infection or not pick up the infection at all. And that's really key. I think that what we saw early in January is what we're seeing again. We want to protect those high risk groups.
Yeah. So is the need for the booster more about the longevity of the shots, or is it more about the age of the people?
So it's both. The vaccine, we know that over time, our immunity wanes. Even if you had the infection or the vaccine, our immunity wanes to them. But we really want to protect the most vulnerable groups, those folks who might end up hospitalized, intubated, and may die from the disease. And we know that those are the seniors and people with high risk medical conditions. And that's who we want to keep protecting.
Yeah. So a lot of people are probably saying, well, if it's safe for those 65 and older, why isn't it safe for those 16 and older? Explain that.
So it's really not about safety. It is these vaccines are all safe. They all have a very long track record. It's been given out hundreds of millions of times here in the United States. We know what they do. We know the side effects. It really isn't about safety. Once again, we come back to who do we want to protect first and the most, and those are our most vulnerable. We could give it to the 20, 30, 40 somethings, and we have been. Those who have autoimmune conditions, people who have cancer, we've been giving it to them. It's absolutely safe. But again, we're giving it to them because they may die from getting COVID.
Yeah, we've heard more about breakthrough infections lately, particularly with the Delta variant. How does this impact the decision?
I don't think the Delta variant so much is the reason why we're giving out boosters. The Delta variant is important because we're seeing breakthrough infections. People who have been immunized are getting Delta. But in what I've seen, both hospital and my clinic, people who have been immunized and get Delta are not sick for very long, and they aren't having to go to the emergency room. That's the great thing. That's what vaccines are supposed to do. This really is more about making sure that those people who got their vaccines very early, frontline workers, and even they did name school teachers should probably get a third shot 6 months after their last shot.
Yeah. Dr. Andrew Carroll, thank you so much. Our ABC15 Health Insider, always appreciate your insight.
Thank you, Faith.